Bismillahirrahmanirrahim. I welcome you all to the session on food and nutritional surveillance. My name is Dr. Fuad Hameed, and today, by the end of the session, all the participants should understand what is surveillance, what are the components of food and nutrition surveillance system, and at the end they should be able to develop a food and nutrition surveillance system. Before I start the session, I would like to kind of introduce the subject. And I would like to say that food and nutrition policies and programs that improve the health and nutritional status of the population require a strong evidence base and capacity to measure outcomes. To fulfill these requirements, there is a strong need for a sustained food and nutrition surveillance system. The objective of this system is to measure and monitor food and nutrient intakes, food security, nutritional status, nutrition-related health outcomes, as well as knowledge, attitudes, and practices on healthy food and other lifestyle factors such as physical activity and healthy environment. This information must be linked to data on demographics, determinants of health, and factors affecting access to safe, affordable, nutritious foods. A food and nutrition surveillance system is an essential instrument for the detection of nutrition and nutrition-related health problems and to follow up on policy implementation for both developmental and emergency programs. I would like to further say that a food and nutrition surveillance system is defined as a regular and timely collection, analysis, and reporting of data on nutritional risk factors, nutritional status, and nutrition-related diseases in population. Furthermore, I would like to define it as a food and nutrition surveillance system is a mechanism to transfer food and nutrition data into action through formulation, modification, and application of the food and nutrition policy of a country. As far as the overall goal of food and nutrition surveillance system is concerned, it is to provide regular and updated information on the nutritional conditions of a population and the influencing factors. And this information will provide a basis for decisions made by those responsible for policy, planning, and the management of programs relating to improvement of food consumption patterns and nutritional status. I would also like to discuss the objectives, the immediate objectives of a food and nutrition surveillance system, and these are to describe the nutritional status of the population with particular reference to define subgroups who are identical as being at risk. This will permit description of the character and magnitude of the nutrition problem and possible changes in these features. The second objective of a food and nutrition surveillance system is to provide information that contributes to the analysis of causes and associated factors and therefore permits a selection of preventive measures which may or may not be nutritional. Further, to promote decisions by governments concerning priorities and disposal of resources to meet the needs of both normal, development, and emergencies. Furthermore, the immediate objectives of food and nutrition surveillance system are to enable predictions on the basis of current trends in order to indicate the probable evolution of nutritional problems, considered in conjunction with existing and potential measures and resources which will assist in the formulation of policies. And finally, to monitor nutritional programs and to evaluate their effectiveness. These were the immediate objectives of a food and nutrition surveillance system. Now, in the next slide, I will discuss with you the objectives in case of emergency. In emergency settings, the objectives specifically focus on the following: a warning system. This is used as a means of highlighting an evolving crisis. Identification of appropriate response strategies. These may include non-food as well as food assistance to address the underlying causes of malnutrition. Then triggering a response. Nutrition surveillance systems provide a trend analysis focusing on magnitude of change. This may trigger an in-depth assessment, which in turn may lead to a response. And finally, targeting, which includes nutrition information which can help target areas that are more at risk or in greater need of assistance. In emergency settings, the objectives specifically focus on things like identification of malnourished children. Some forms of surveillance can identify acutely malnourished children. According to the time frame and the type of information required, the aims of food and nutrition surveillance system can be grouped as indicated in the table which I have shown in this slide. So, this table is divided into 4 components. One is the purpose, then is the time frame, the third is the type of information required, and finally the leading sectors from where this information is gathered. So, if starting off with the first, the purpose is to have a warning system of nutritional emergency, and it's of course a short-term thing. Because emergencies just arise and you have to deal with them. And the type of information required is that is food available during that emergency, and the early effects on nutritional status of the people who have been affected by that emergency. And the leading sectors are agriculture, meteorology, because a lot of climate change is taking place, and even otherwise. There could be earthquakes, it's an emergency. There could be floods, it can create an emergency. And similarly, other climate related conditions can create emergencies. Then the other sector is livestock, food, and the health sector. The second objective or the purpose could be to identify the trends of malnutrition over a number of years, and in this the time frame is medium to long term, and the type of information required is change in nutritional status, trends in the economy and agriculture, and the leading sectors are health, economic affairs, and agriculture. And finally, the third purpose is to identify the trends in nutritional effects of affluence, and the time frame is medium to long term, and the type of information required is change in nutritional status, morbidity, and mortality from specific diet related diseases. So it may also include non-communicable diseases, especially metabolic diseases, cardiovascular diseases, so on and so forth. And the leading sectors are health and food security. As far as food and nutrition surveillance is concerned, the scope of this system, or the function and scope, I would say, are that the food and nutrition surveillance system is an instrument or tool used to generate information that is very helpful for the formulation, modification, and application of food and nutrition policies of a country. And when we talk about the function and scope, you can see in this diagram that first what we do is that we assess the situation of the nutritional situation in a target population, and then we analyze that data of the causes of the problem. If there is a problem, then we analyze what are the causes of the problem, what are the root causes, what are the primary causes, what are the secondary causes, and from this analysis we undertake action based on analysis and available resources, and then this is a continuous process. So this is the scope and function of the food and nutrition surveillance. Furthermore, as far as the functions are concerned, I would like to further describe the functions. As far as the food and nutrition surveillance system is concerned, it involves a continuous process of comprehensive multi-sectoral data analysis and interpretation, and has a variety of functions as described in the following slides. The first is the national and sectoral planning and policy design. I would like to explain it a little further. Well, as far as the national and sectoral planning and policy design is concerned, planning at the national level usually consists of a periodic review of the government policies and defining medium and long range goals that will contribute positively to designing or adjusting such policies. And this requires a multi-layered vision of food and nutrition problems that goes beyond any single sector. The role of a surveillance system is therefore to provide continuous analysis, integration, and interpretation of data from multiple sources, ensuring a systematic flow of information from different sectors. And this analytical process should be both inductive and deductive, and should be integrated rather than just culminating in the presentation of a compendium of multi-sectoral data. In this way, an appropriately planned and established surveillance system will support high-level decision making through analysis and interpretation of sectoral data. Here I would like to give a personal example. I've been working as a senior policy advisor with the World Bank, and one of my major assignments was to develop an accelerated program for reduction of stunting. And in that, the request was forwarded by the government of Sindh. And over there, while preparing this accelerated program for reduction of stunting, I had consultative meetings with several departments, which included, so it became an intersectoral or a multi-sectoral program. So we did multi-sectoral planning at the policy level, and then of course we later on worked on developing monitoring and evaluation, and we identified what are the problems, how we are going to do advocacy, what would be the timely warnings or when are red flags going to be raised in case of food shortages, and as far as the monitoring effects of structural adjustment policies are concerned, how we are going to proceed in those cases. But as far as this analytical process was concerned, it was both inductive and deductive. And we consulted the health department, the agriculture department, the livestock department, the fisheries department, local government department, and public health department, then population welfare, and this is how the social welfare department as well. And this is how we came up with a multi-sectoral plan. Moving on with the functions, the second is program monitoring and evaluation. Well, the question arises in your mind, what is program monitoring and evaluation in case of food and nutrition surveillance? Just take a while and think about it. What would it be? I'll give you 10 seconds. Some of you might have, of course, would have made out what program monitoring and evaluation would be in case of food and nutrition surveillance. Food and nutrition programs can potentially make an important contribution to the food security of vulnerable populations. And such safety net programs usually have earmarked financial resources from the social fund or from the donors in countries with emergency based operations that address vulnerable groups at risk. And measuring the impact of food and nutrition programs and their efficiency is important to both political and management leaders. Thus, subsystems of data collection and analysis are essential and must be integrated into the surveillance system. So, this is how this monitoring and evaluation system works. The surveillance system should include an information management system that routinely collects and analyzes program and population-based indicators and evaluates the success or failure of such programs. So, while I mentioned about the political and management leadership, so this accelerated program on reduction of stunting, which I mentioned to you earlier, in which I was working as a senior policy advisor on behalf of the World Bank for Government of Sindh. So we were dealing with for the Minister of Finance, with the Minister of Planning, with the Minister of Food Security as well, when we were developing this plan. So, and at the same time, we interacted with the secretaries of all the departments, which I mentioned to you earlier. And this is how we got a buy-in from all these stakeholders as well. So when the plan is made, when all the systems are developed, including the monitoring and evaluation, so these are implemented in the field. The third function is problem identification and advocacy. Again, I'll give you 10 seconds to think what does problem identification and advocacy mean in case of food and nutritional surveillance. I'm sure most of you would have made out what does it mean. Well, advocacy can either be undertaken by sectoral groups within the public sector or by non-governmental organizations serving vulnerable group or disadvantaged populations. The surveillance system may also be of use to community groups and other organizations by giving them access to resources and providing situational analysis support by data that will help increase the flow of resources to support food and nutrition activities from the government and donor communities. And it also assists in setting priorities for targeting resources to most needy people from deprived communities or subgroups. In addition, a surveillance system serves as evidence to support advocates, policy or program proposals. Advocates' claims benefit from the efficiency, accountability, transparency of the system, and their impact is thereby strengthened and more able to attract key partners. So, as far as the key partners are concerned, while I was explaining you this problem identification and advocacy, I mentioned that the flow of resources for support of food and nutrition activities come from the government and donor communities. And this is how World Bank got involved. And it was not only the World Bank when we made the program for the government, then we took this program to the multi-donor support unit, in which there are different donors, which includes the World Health Organization, UNICEF, the World Food Program, and all these and other. There are also some countries which donate. So we also invite them to the multi-donor support consultative meetings. So this is how first the problem is identified, then plans are made, and then those are presented to the government as well as the multi-donor consortiums. So in the case which I have given you an example of, in that the government had to take the ownership, and the government had to pledge 20% of the funds. So when the government had pledged 20% of the funds, then the donors came in and they said, okay, this is the amount of money we are going to chip in. Everybody had a different figure. And then these funds were spread over the next 5 to 10 years because it was a mid and long-term plan. Another function of the food and nutrition surveillance system is timely warning of food shortages. Very, very important. An early warning system is an efficient tool in disaster management. The region has normally a lot of regions get affected by different crises such as high food prices, climate change, unexpected floods and droughts, and man-made disasters. And timely warning systems can be powerful tools for preventing critical food shortages and sudden decrease in access to basic foods in affected countries. Warning systems routinely analyze multi-sectoral information, example food stocks, market prices, agroecological factors, and food insecurity, and provide periodic assessments of the risk of central and local shortages. This information must be closely linked with the decision-making process to enable a rapid response, otherwise the information serves no purpose. Data generated must be effectively integrated with decision-making as rapid action is required. Without such integration, there is little justification for timely warning systems. And I'm sure while I was telling you these things, you must have made out that there have been sugar crises in different countries, there have been wheat flour crises in different countries, and I think these crises were a result of poor or no timely warning of food shortages systems. There was no proper food and nutritional surveillance going on. Otherwise, red flags would have been raised ahead of time and the situation would have been managed effectively as well as efficiently. Well, moving on to the next function of the food and nutrition surveillance system, it is monitoring, monitoring effects of structural adjustment policies. Well, it's a little bit more technical, so I won't tell you to just think over it. Of course, those of you who are more knowledgeable can make it out what it means, but I'll explain it to you. Well, as far as structural adjustment policies are concerned, these are prescriptions to reduce government regulations and spending and to increase government earnings and repayment of international responsibilities. And when we say international responsibilities, these are, of course, loans taken by governments. The value of these policies established during the 1980s, 1990s, and in the present millennium have been discussed widely at the international forums, and it has become clear that the effects of such policies on food security and the nutritional status of the population must be carefully examined and monitored. In particular, it is essential to monitor the effects of these policies on food security, especially of the poor, in order to provide feedback to policymakers with aim of strengthening positive effects and mitigating negative ones. So, since you are the future, as far as the students are concerned, you folks are the future of any country, of this country, any other country in the world. And it is up to you to devise such systems and make sure that information is reaches the policy makers on time. You are also going to become policy makers, so you've got to be very sensitive that continuous monitoring and evaluation is going on and you are getting continuous information. If you are sensitive to the situation around, especially we are talking about food and nutrition, so I am 100% sure that inshallah you will be able to avert a food crisis. With this, I move to the next step of my discussion, and as far as now, I'll be discussing with you the methods of food and nutritional surveillance system. And in normal situations, the following common methods are recommended for establishing, you can see in the slide, but I've just given bullet points, but I'll be explaining you things more on my own. The following common methods are recommended for establishing a food and nutrition surveillance system under normal conditions. So you can just go through the bullet points. I'll give you again around 10-15 seconds and then I will start explaining you each bullet point one by one. I hope you've gone through them. So starting with the first one, which is large scale food and nutrition surveys. Well, the surveillance system should make an inventory of all large national surveys related to health, food and nutrition. That could act as a basis by breaking data down at the sub-regional, district and village levels. In particular, frequent surveys such as the Demographic Health Survey, National Nutrition Survey or National Food Security Surveys should be considered. And try to include selected nutrition indicators in these surveys. Well, the next is, the bullet is repeated and small scale surveys. So, I would explain it in a way that repeated small scale surveys are population based surveys that are standard methods to collect quantitative and qualitative data. They assess the type, severity and extent of malnutrition and its causes among representative sample of the population, especially the children or adults. Their purpose is to support policymakers and managers to design strategies and prioritize geographical areas at risk and specific types of interventions. Repeated surveys include national surveys, which are periodically conducted at national level, and small-scale surveys, which are carried out at local level to gather nutrition information at a suitable time. So, I hope you understood it, that of course these surveys, even if these are small-scale surveys, these can be conducted these could be at a smaller scale at the national level, but at the same time we can also consider small surveys at special geographic areas. If there has been a flood in a particular area, so maybe only 4 or 5 villages are affected, maybe a population of 25,000 people is affected. So we can have these small scale surveys at different areas where the need arises. The next is the centennial sites surveillance. Well, centennial site surveillance involves surveillance in a limited number of sites to detect trends in the overall well-being of the population, The sites may be specific population groups of villages that cover populations at risk. And trends are monitored for various indicators, including nutritional status, morbidity, dietary issues, coping strategies, and food security. In this case, data can be collated and analyzed centrally. Centrally based centennial site surveillance, or by trained members of the community, which means community based centennial site surveillance. Here, I would like to give you an example. Like if we, as I mentioned, that these are limited number of sites. So what we can do is, if we are doing some surveillance, food and nutrition surveillance, I can give you an example of Punjab. This is a big, huge province with a population of more than 120 million people. So what we can do is, we can select a place in central Punjab, which could be Lahore, Sheikhupura, Faisalabad, any of the cities, or the rural areas attached to these cities, and make a centennial center over there, centennial site surveillance center, the site. And then we can have a site in northern Punjab. It could be Attak, it could be Fateh Jung or someplace else. And then we can have a site in southern Punjab, which could be maybe Rajanpur, at the Tehsil of Rajanpur, or Rahim Yar Khan, or Bahawalpur. So this is how we select centennial sites and then conduct centennial site surveillance over there. Then school census data, as you can see in the slide, is also of prime importance. And nutritional assessment is occasionally undertaken in schools, where first grade children are measured through census every 2 to 3 years. The objective is to identify high risk children with poor health, malnutrition, and low socioeconomic status. The results can be used to target school feeding programs and support policy making and food based strategies. The need for monitoring obesity among school age children is becoming more important, but more so in cities. And of course, this is a big problem in the developed world. And school census data, supported by information on specific food consumption patterns, marketing of healthy food, and information on physical activity levels, are very important to understand the main causes of obesity. Finally, is growth monitoring. And growth monitoring is a continuous monitoring of growth in children. Its aim, you can consult one of my lectures. It is available on YouTube. And if you enter nutritional surveillance and growth monitoring and write my name, Fuad Hameed Rai, Fuad Fuad, Hamwed Hameed Rai Rai. So you can also access that lecture. So it also includes, in addition to nutritional surveillance, it also has growth monitoring, and I've also compared both nutritional surveillance and growth monitoring as well in that lecture. Well, as far as growth monitoring is concerned, as I mentioned, the main focus are children, and its aim is to identify slowing or flattering of growth at the individual level, and thus help to correct the problem promptly. And formerly, growth was usually measured as weight for age once per month. However, the World Health Organization new growth curve, weight for height or for length, is now recommended. And growth monitoring can either be conducted by health professionals at maternal and child health clinics, which means clinic-based growth monitoring, or by trained members of the community in villages, which is community-based growth monitoring. And in case of Pakistan, it is the lady health visitors. They are supposed to visit homes, so they can do this community-based growth monitoring, or the lady health workers, LHWs, they can also do this. With this, I conclude with the methods of food and nutritional surveillance system. Well, everything which we implement, either at a small scale or at a large scale, has challenges. And The most important aspect of food and nutrition surveillance system is to ensure that we have effective links between information and action. It is not only that information is collected and no action is taken. Then, of course, reliability of data is very, very important. Timeliness of reporting. If there is a crisis now and if it is reported after 6 months, that's of no use. So timeliness of reporting is very, very important. Then efficient action. If it has been reported, then efficient action has to be taken so that the population at risk is catered to and they are served. And finally, sustainability and interpreting the findings. Sustainability is something like it has to go on and on. It's a continuous process and it has to be sustainable. What has to be sustainable? The food and nutrition surveillance system has to be sustainable. And it has to cater to the needs of the population. And the interpreting of the findings should go continuously. If things are going fine, of course, we should say, okay, things are going fine. But if there are any problem areas, they should be immediately identified. And the most important aspect of food and nutrition surveillance system is to ensure effective links between information and action. But the reliability of data, timeliness of reporting, efficient action, management and sustainability are all challenging. A further challenge is interpreting the findings, and similar levels of acute malnutrition may have different significance depending upon the context. Unless the underlying causes of nutritional disorders are understood, the appropriate response may not be provided. Well, then users and users of surveillance information system. You can see in this slide, in this table, I've highlighted the stakeholders, which is the government, the health sector, the non-governmental organizations, academic institutions, food industry, and the general public. And the purpose, if we talk about the general public, it's information, advice, and education. About the food industry, it's food labeling and food marketing. About academic institutions, it's teaching, research, direction, data for research. So you can go through this slide. You can even later on go through my lecture. You can pause things. You can go through it. And I will still advise you, although my this session is very, very elaborate, but I would still suggest, if you want to consult your books, please go ahead. Well, as there are many factors leading to malnutrition, such as socioeconomic status, potential users of nutrition surveillance information are found in various sectors, and you can see all those sectors in this table. And although it is unrealistic to expect nutrition to play a leading role in decisions on overall resource allocations, nutrition surveillance can be used to analyze policies for nutritional consequences, suggest alternative nutritional policies, and eventually to assess their effects. And this is an advocacy. There's also an advocacy role for long-term nutrition surveillance in helping other similar methods trying to detect fundamental causes of malnutrition. Well, as far as the sources of data are concerned, you can see over here the sources of food and nutrition surveillance data can be primary and secondary, and the primary data are collected through surveys specifically designed to monitor food and nutrition. National Nutrition Surveys are the major source of primary data and provide detailed and specific information on food and nutrient intakes, nutritional status and nutritional health status. And ideally, food and nutrition surveillance data should be collected continuously. However, this is not a practical option for most countries, as nutrition surveys are expensive to undertake, and most countries undertake national nutrition surveys on a periodic basis, approximately 3 to 5 years up to 10 years, which is considered sufficient to keep up with changes in dietary patterns and new food technologies. And then is the secondary data, which is derived from data collected from for purposes other than food and nutrition surveillance. And potential sources of secondary data include routinely collected health statistics, household budget surveys, market research surveys, industry surveys, and research studies. Well, issues to be considered when evaluating the value of secondary data sources include, you can see in the slide, periodicity of data collection, which could be ad hoc, periodic, or continuous, then frequency of data collection on weekly, monthly, or yearly basis, then level of aggregation at the individual, household, or national level, and sample size and sampling strategies are also very important. Then format in which the data are stored, either they are being stored in computer or on paper. Then availability of cost data is also very important. Then the sources of data for each surveillance element are listed in this table. You can see the sector, the data source, and there are comments also explained over there. Like if we talk about the sector of food supply, the data source is health economic survey, household surveys, food balance sheet, at the national level, and I would say that it includes a national and household food supply. So this table covers the food consumption sector, the dietary patterns, the nutrient intake, the nutritional status, nutrition related health status, food security, food culture, and so on and so forth. So you can later on pause my lecture and you can read it in detail. Well then, food and nutrition surveillance system indicators are of prime importance. And nutritional indicators are used to monitor, diagnose, and evaluate nutrition and nutrition-related intervention in individuals, and they also are used in populations to determine the magnitude and trends of nutritional problems under surveillance, their location and causes, and to evaluate the impact of nutritional programs and policies. And these nutritional indicators are also used in research to identify the biological and social mechanisms affecting or being affected by nutrition. All of these activities include measurements of nutritional indicators. However, the choice of indicators, their measurement and analysis can be very different in research, patient management, public policy, or planning and evaluating programs. You can see in this slide the indicators are at the individual level, example patient diagnosis, screening and monitoring, and at the population level as well, example setting policy, program evaluation, and nutrition surveillance. Therefore, I would say that there is no best indicator, but best measure for an indicator or best analysis of an indicator in a general sense, because it depends on what is most appropriate in each situation, depending on the purpose for which the indicator is intended. And nutritional indicators can be used to measure the nutritional determinants or consequences, as I have shown you in the slide, at the individual level as well as at the population level. Well, talking about the type of indicators, indicators for assessing and analyzing nutritional status are nutritional status indicators. I'll briefly explain to you what are nutritional status indicators. Well, and why are these important? Well, combating or controlling malnutrition depends primarily on the information regarding the nutritional status of the population. So, such information is provided by indicators of nutritional status which characterize the nature of the malnutrition problem, and they are linked to the characteristics of individuals, times and locations in order to obtain an indication of the distribution of the problem in the population and thus an overall picture of the situation. And when defining priorities for nutritional situation, we need to ask questions. Different questions like what is the type of malnutrition, and is it undernutrition, overnutrition, micronutrient deficiencies, what is its severity, who suffers from malnutrition, then where are these malnourished individuals, when is it occurring, is it temporary, seasonal or annual, recurring or not, is it chronic, the nature of the problem, is it emergency or it's a normal situation, and Well, as far as the second is the indicators of causes. And once the nutritional status of the population and its geographical and or socioeconomic distribution are known and the goals for improvement have been set, information is needed on the determinants of the situation, I mean on the factors, events or characteristics that are likely to affect the nutritional status of individuals within the population at different levels. And there are different types of continuing with that. The immediate causes of malnutrition, undernutrition are inadequate dietary intake, then diseases. Then underlying causes of malnutrition, undernutrition are food insecurity, environmental hygiene, and access to health services. Therefore, fundamental agroecological and socioeconomic indicators also need to be included in any casual analysis of the nutritional situation at a national level. Then different types of indicators, on the basis of an up-to-date evaluation of the country's nutritional situation and in view of the different causes of malnutrition identified at various levels, the role of nutritional policies is to set priorities, to translate them into general goals, then into strategies and programs, each with specific objective and indicators. And nutritional indicators, you can see over here, these are the nutritional indicators. Then traditionally, nutritional indicators have been classified as biochemical, clinical, anthropometric. It includes dietary intake. And this classification is appropriate only in relation to the human resources and facilities required to evaluate these indicators. Then food and nutrition surveillance system implementation is very important. And as far as the implementation is concerned, why is implementation important? I would say that the decision to establish a food and nutrition surveillance system has to be based on clearly defined objectives. And if you go back into my today's session, you will see that I started off with the definition, I started off with the goal, and then I came to the objectives. And then there were a few objectives in normal situations, and there were a few objectives in emergency situations. And when we have clearly defined objectives and taking into considerations the availability of resources, staff capacity, sustainability, environmental factors, and capacity to respond to emerging nutritional and nutrition-related health problems, this is how we start implementing things. And once the decision has been made to establish a surveillance system, the first step is to establish a central nutrition surveillance unit. You can see these things in the slide also. I've just given the bullets, but I'm explaining you more. And after this central nutrition surveillance unit, what it will do is that it will organize all the activities necessary to implement the surveillance system. And then at the organizational level, we need to have an institutional framework to implement sustainable surveillance systems, activities. A well-organized, qualified structure is required. And qualified structures often already exist, although these may be incomplete or inefficient. Example, health information system, agricultural information systems, the Central Bureau of Statistics, the Economic Analysis Unit, etc. And then the Central Nutrition Surveillance Unit, as far as this is concerned, the main function of the Central Surveillance Unit, which can either be an individual or a small group, is to coordinate and to provide and explain information. And the short-term operational objectives are aimed at satisfying users' needs. Example, information requirements, training, guidance, proposing alternative strategies or interventional programs, and enhancement of the quality of information. And then as far as the central nutrition surveillance, the central unit, normally who are the users are central unit users also have other objectives related to the different fields of application of surveillance, like formulation of policies, investigation of the causes of nutritional problems. In this slide, you can the data will be collected at different levels: community, health, facility, district, regional, national level. You can see this slide later on. You can pause it, go through it. At what level, what kind of data is required, or what kind of data is collected. Well, now I'm at the end, and before I end today's lecture, I would like to highlight the characteristics of a good nutrition and surveillance system. And the first is capacity to act on information. What does it mean? Do you have any clue? What does it mean? Well, capacity to act on information, I would say first and foremost, the system must be able to act on information produced, whether in terms of a well-organized response to the rising nutrition problem or of managers using the information to make better, medium and long-term decisions. Then the second is standard case definitions and reporting protocols. These allow correct and timely documentation and reporting, basic and sound investigation methods, appropriate analysis and interpretation techniques should be used. Then adequate laboratory support is very important, and appropriate actions require accurate detection. Cases detected in the field may require more sophisticated labs for confirmation of the diagnosis, and efficient communication systems are important to communicate these diagnostic results, and information and feedback must pass quickly. And another characteristic of a good nutrition surveillance system is cost-effective resource use. The system must focus on priorities to keep nutritional problems under control and on cooperation where appropriate to save duplication of efforts. And finally, a network of interested people. The system is only as good as the people who operate it. With this, I end today's session. I hope you would have understood the subject in detail. Still, a quick revision. As far as nutritional surveillance is concerned, the strategy is detection of undernutrition or of any issue related to nutrition. The approach is diagnostic and interventional. Enrollment, as far as enrollment are concerned, we take a representative sample. Ages, representative ages at longer intervals are taken, and as far as the number is concerned, any size of group can be taken, 50 to 100 most efficient, and this is how we go on. We need trained workers, we need to have precise nutritional status, we need to detect malnutrition. Then nutritional rehabilitation has to be undertaken, often with supplements, and long regain of good nutrition in community has to be focused. Then food supplements of community wide need food supplements, and a community-wide response is required. A food subsidy may be given in certain cases, and malnutrition should be addressed. We should rehabilitate people, and if needed, in special centers. With this, while concluding, I will say Alhamdulillah for everything, and all of you should always say Alhamdulillah for everything. Well, as usual, I always give a message of the day, and again today I have a divine message for you from the Holy Quran, and the Holy Quran says, and they, righteous people, give food in spite of love for it to the needy, the orphan and the captive. We feed you only for the countenance of Allah. We wish not from you reward or gratitude. So always think of the needy, always think of the orphan, always think of the captive. And although you might be in need of food yourself, but as a quote from Hazrat Ali, Razila Ta'ala anhu goes on that whenever you eat food, keep one part of your stomach empty and don't fill it up to the brim, and also think of others. With this, I thank you and I wish you all the best, and Allah Hafiz and take care.